So now we will be discussing the topic of growth and development. This is a topic that scares students a lot. But after this discussion, you will enjoy solving the questions from growth and development. So let's begin. A 3-year-old child is said to have delayed milestones if he fails to, and your options are A. Use a spoon, option number B. Draw a square, C. Skip, D. Climb alternate steps downwards. And the correct answer for this question is option number A, that is use a spoon. We will discuss about the remaining options subsequently. The next question is, bidextrous grasp develops by the age of, and your options are A. 5 months, B. 7 months, C. 9 months, and D. 12 months. And the correct answer for this question is option number A, that is 5 months. So let's see the different aspects of grasp. So you should know the concepts of grasp and how a child attains it. So first, the child attains a bidextrous grasp, which means that the child will use both his hands to approach an object. So this is bi, that means he will use both his hands, and this is attained at around 4 to 5 months of age. Following this, when the child matures, he will use his one hand to reach out for an object. This is the unidextrous grasp, and this is achieved at around 5 to 6 months of age. And it is only after the unidextrous grasp is achieved, the child will be able to transfer objects from one hand to another. Following this, you should know what is the ulnar grasp. So this ulnar grasp is, so this is the palmar grasp and this is the ulnar grasp towards the ulnar aspect of the hand. Following this, the child develops a radial grasp. That means the grasp matures a bit. So this is at 9 months of age when the child attains the immature pincer grasp. And following this, at around 12 months of age, the child attains a mature pincer grasp. So these are very important MCQs that you repeatedly get in the exam, all collated under the grasp. Coming on to our next question. A child can transfer object from one hand to another. What does it imply? And your options are visual motor coordination, B. Explores small objects, and C. Object release, and option number D. Weakness of one hand. And the correct answer to this question is option number A, that is visual motor coordination. So I'm sure you would agree that just like attaining different milestones, the vision also improves from birth over a period of time. And at around 18 to 20 weeks of age, when the hand regard appears, and following this, there is visual motor coordination, after development of which can a child transfer object from one hand to another. Now coming on to the next question. Which of the following are the first permanent teeth to appear in a child? And your options are A. First molar, B. First premolar, C. Lateral incisor, and D. Canine. And the correct answer to this question is option number A, that is first molar. So we see this is the sequence of appearance of the permanent teeth. But please don't get scared by seeing this table. I will simplify you a bit. So you can remember this sequence by remembering a simple mnemonic, and that is Mama is in party, Papa can make momos. So molar, incisors, central incisor, lateral incisor, first premolar, second premolar, canines, second molar, subsequently the third molar. So this table should not scare you anymore. Remember this mnemonic and you will be able to answer any question with regard to the appearance of the permanent teeth. But similarly, you can also get a question on primary dentition. So this is the sequence of appearance of teeth for primary dentition. So I'm sure you are aware that it is the central incisor and the lower one which is the first teeth to appear. That is around 6 months of age. Now how to remember the prime timing of eruption for primary dentition? Again, very simple. Just try to remember this simple mnemonic. चलो लंदन में चिल मारे. Central incisors, lateral incisors, molars, canines, and then second molars. So in this way, you can remember the sequence of appearance of the primary dentition as well. So I'm sure after this, if you get any question from primary dentition and secondary dentition, you will be able to answer the question. So now let's come on to our next question. So a girl of 6 years of age can climb up the stairs with alternate feet, can remember the name, age, but cannot narrate stories. What is her actual developmental age? And the correct answer for this question is option number A, that is 3 years. So now we will discuss this question in detail. I'm sure by this time you know that milestones are assessed in 4 domains. They are gross motor, fine motor, social and language. The gross motor milestones help the child to attain locomotion, while the fine motor milestones are what the skills that the child will acquire by the use of his hands. So now let's try to know and just see how we can remember these different milestones. So this is a simple way in which you can remember what gross motor milestones the child will be able to attain in first 12 months of life, that is in the first year. So by the time the child is 6 months of age, he will be able to sit with support. So this is the timeline for the first 6 months. While in the next 6 months, from sitting without support, the child will be able to walk without support. So in the first year of life, this important milestone is attained of walking without support. And the next important milestones usually are seen at every year. So by the time the child is 2 years of age, he will start to run. And the next important milestone is achieved at around 3 years of age, when the child will ride a tricycle. So tri means 3. So the child will be able to ride a tricycle at 3 years of age. Then the next important milestone of gross motor, which is frequently asked in the exam, is hopping, which again comes after an interval of 1 year. So at 4 years of age, the child will be able to hop. And by the time the child is 5 years of age, he will be able to skip. So if you just want to remember, at 1 year, the child will be able to walk. At 2 years, he will be able to run. At 3 years, he will ride a tricycle. At 4 years, he will hop. And at 5 years, he will learn to skip. Similarly, with the fine motor milestones, you can see we have already discussed about the grasp. So by 12 months, the child is able to attain the mature pincer grasp. So once the child has attained the mature pincer grasp, the next important fine motor milestones are the pre-writing shapes. So again, you can remember them by remembering that most of the major milestones are coming at an interval of 12 months, that is at an every yearly interval. So at 12 months, we had seen that the child has attained matured pincer grasp. So by the time the child is 2 years of age, he can make a standing line, and around the same time, that is 2.5 years, he is make a sleeping line. So at 2 years, he is making a horizontal or a vertical line. Then at 3 years, he is able to make a circle, again which is frequently asked in the exam, followed by making a rectangle at around 4 years, and then at 5 years he can make a triangle. Again, the important shapes: 2 years, 3 years, 4 years and 5 years. These are the ones that are frequently asked in the exam. So these are the blocks as well. And then coming on to the language. So till the time the child is 9 months of age, he will have some pre-linguistic language skills. These are babbling or cooing sounds. But again, you can remember the important milestones. So by the time the child is 1 year of age, he can use one word. So one word at 1 year of age. Then at 18 months, his vocabulary is of around 8 to 10 words. 18 months, 8 to 10 words vocabulary. Then at 2 years of age, he can make a sentence of 2 to 3 words. So again, it is easier to remember. By 1 year, he can speak one word. By 18 months, he has a vocabulary of 8 to 10 words. And by 2 years, he can make sentences of 2 to 3 words. Then subsequently, for trying to make it simple for you, just try to understand. So at 3 years of age is in most of the schools, this is the age at which formal schooling starts. So at 3 years of age, the child will be joining formal school. Now this is the first time the child is moving out of the house. So he is very inquisitive and he is asking his mother, "Where are you sending me, Mama? Where are you sending me? Whom will I meet there?" So he is asking a lot of questions at 3 years of age, at a time when he is moving out of house to go to his school for the first time. So at 3 years, he is asking questions. Then imagine, or just try to remember it, at 3 years, the child has started school. Now he is attending his formal school. So how will the teachers inform or let the parents know that they are really working hard with the child and what all things they are making the child to learn? So they have taught so many songs and poems to the child that by the time he is 4 years of age, that is, he has spent 1 year in school, he is all the time singing songs and reciting poem. So this is how the school is telling the parents that, look, we have really sharpened the language skills of your child. So by the time the child is 4 years, he is singing song and reciting poems. And by the time he is 5 years, he is really intelligent. The school has really worked hard with him. And they also want that the parents should also work hard with the child. So the child is always asking questions from parents, always asking meaning of words. What does this mean? What does this mean? So by the time the child is 5 years of age, he will keep on asking meaning of different words. So that is how language milestones can be remembered. Now coming on to the social development. The first major milestone that is identifiable in the social domain is the social smile, which is attained at around 8 to 12 weeks of age. This is a very important milestone that you should remember, and this is one of the major milestones which a mother can identify. So this is at around 8 to 12 weeks or around 3 months, following which at 6 months of age the child is playing with the mirror. So again, I will just try to formulate a story for you so that you can remember these milestones as well. So imagine when a baby is born, the mother is almost always with him. And if she's a working woman, she is there with the child almost for 6 months till she joins back to work. So this is the first milestone that the mother is able to identify in the child, that is around 8 weeks. And by the time the child is 6 months, the child learns to play with the mirror image. But now it is 6 months, mother has to go to work, but the child is now used to having mother all the time with him. He is just not ready to let his mother go. Now mama has to be really active and she has to think of various means to let the child stay calm. She even gets a Santa at home so that the child will be calm at home in her absence, but it doesn't help it. He is crying all the time. Why? Because he has developed stranger anxiety just at the time when the mother has to join back work. So stranger anxiety comes at around 6 months of age. But the child gets used to the mother going back to work. So in the next 3 months, that is at around 9 months of age, he is now accustomed that yes, mama will go to work in the morning, she will come back in the evening. So when mama goes, he waves bye-bye to mama. So at 9 months of age, after 3 months of hard work, the baby finally says bye-bye to mama when she leaves for work. So then subsequently at around 15 to 18 months of age, the baby is getting active and he wants to help his mother in every task. He sees that the mother looks after the home as well as the office, so she needs some help. So the baby copies parents in various tasks, copies in mopping, in all the household chores that are commonly seen at home by the child. And then again, our important age of 3 years, when the child has to go to the formal school. So mama is trying to tell the child your name, your age, your gender, so that when the baby goes to school, he should not get lost in the school. So by the time of 3 years, an important age when he has to start his formal school, he should know his name. What will happen if the teacher is calling out their name for attendance and if the child doesn't know? So mama trains the child extremely well so that by the time the child is 3 years, he will know his name as well as the gender. And then while the child has joined school, he learns a lot of things, and amongst them, the most important or one of the important is playing cooperatively in a group at around 4 years of age. Again, an important milestone after 1 year of school. And then at around 5 years, the little one has become really responsible and has actually started to help mama in household chores as well, and not just copying but helping in actual terms. So in this way, you can remember most of the milestones of all the 4 domains that are frequently asked in the exam. And I'm sure after this discussion, you should not be able to forget these important milestones.